All attendees are in listen-only mode.
Good afternoon or good morning, and welcome to the monthly Strengthening Families Networking webinar. We're very excited that so many people were interested in the topic for today. Today we're focusing on cafes that are designed to build protective factors, and we'll particularly be looking at the Caring Conversations Cafe model, but also hearing updates from the other models that are out there in the field and that many of you have been using. So I'm Caitlin O'Connor, I'm Caitlin O'Connor from the Center for the Study of Social Policy. I will just give a little bit of information here up front about these webinars in case it's anybody's first time joining us. We issue an open invitation to anyone using the Protective Factors Framework or coordinating Strengthening Families efforts, whether that's in a state or a community or an agency or a program. These webinars are jointly convened by my organization, the Center for the Study of Social Policy, or CSSP, and our partners, the National Alliance of Children's Trust and Prevention Funds. Each month we have a different topic, with the topic and guest speakers coordinated either by CSSP or by the Alliance, or sometimes by a volunteer from the network. There's a link here, which is where all the recordings and materials from past webinars are posted. You can also always get that link through the Strengthening Families e-update newsletter. And when you participate in the webinar, you get a follow-up email that will also include that link. A couple webinar tips in case you're having any audio trouble. The main trick is to always make sure that GoToWebinar knows whether you're listening through your computer or if you've dialed in by your phone. And if you dial in with your phone, if you enter your audio PIN, which is personalized to you, then it will let us know who you are if you want to raise your hand or type in a question. So I recommend that you do that. Then we'll be able to unmute you if you want to ask a question. And the number one tip, if you're having trouble, hang up and dial back in, and hopefully it will resolve itself. If you do need help, type a question in the chat box, and we will try to help you out as much as we can. Okay, so these are monthly webinars. Our upcoming ones are on March 10th, where we will be hearing about strengthening families and relationship and marriage education. We have a paper about to come out on that, and we'll be hearing from two of the authors of that paper, who are both professors of extension and who are on their state Strengthening Families leadership teams and have gotten together to do this comparison to Strengthening Families protective factors. On April 14th, we're going to focus on trauma and protective factors, probably the most frequent request we get for content right now, as everyone's coming to greater understanding of trauma and toxic stress and wondering how to link that those efforts in their states or communities to protective factors work. So I'm going to share some materials that we have about that and have some conversation with people who are already making those links in their communities. Then we'll have one on May 12th as well. The topic is to be determined. And on that note, if you would like to present or facilitate a conversation for one of these webinars, please contact me. Let me know a topic you're interested in, and we can look at dates that are coming up that aren't booked yet. And you can present or facilitate or pull together the right people, and we always appreciate volunteers to do that. Okay, so today's agenda, I'll be giving some updates from CSSP. Then we'll have updates, it says Martha Reeder, but Teresa Rafael is actually with us to give updates from the National Alliance of Children's Trust and Prevention Funds. Sorry about that, Teresa. Then we will hear about the Caring Conversations Cafe model from Aidan Bolander at 0 to 3 and from Jamie Ward at Curricula Concepts in Arkansas. And then we're going to talk more generally about how cafes are used in the Strengthening Families world, including some updates from Dara Griffin from Be Strong Families and Parent Cafe, and from Robin Higa from the Community Cafe Collaborative. So with that, let's jump in. There I am. I'll be sharing the updates from CSSP. Each month we've been releasing one more module in this scripted curriculum for Strengthening Families, and I'm pleased to say that the 7th one was just released. It's about the research behind Strengthening Families. It's about a 45-minute module, shorter than most of the others in this scripted curriculum. The scripted curriculum as a whole was designed for child welfare staff, but some of the modules are more user-friendly for other audiences as well, and this is one that could be really used for any audience that's interested in what we mean when we say that Strengthening Families is an evidence-informed framework, and all the other things that go with it, but all the research that's behind the Protective Factors framework itself and the research that has happened in the field as it's been implemented and we've tested different ways of using it. So we also have a paper about that you may have seen before. This is a presentation version of the same content. I encourage you to check it out. Also, if you look in the webinar itself, you can see a list of handouts. There's one that's a scripted curriculum overview. So if you're curious about this scripted curriculum, please download that or look it up on the website and let me know if you have questions about it. We really encourage you to use it, maybe share it with your child welfare training academies and see if they would like to incorporate some of that content if you're trying to get a protective factors approach into the child welfare system in particular. Also in the child welfare realm, but I think really applying to a lot of our work, CSSP was part of the Quality Improvement Center for Research-Based Infant-Toddler Court Teams. This is a quality improvement center that's led by 0 to 3, and CSSP is one of the partners. And we just released, through that QIC, a brief about sustaining new approaches in child welfare. And while it has child welfare in the title and it's focused on these infant-toddler court teams, it really is about sustainability and how to think about sustainability in any kind of cross-systems collaborative effort. And so I encourage you to check that out. Let us know what you think of it. I'd be curious to know if there's a lot of interest in this sustainability framework among the Strengthening Families National Network. We could certainly devote a webinar to it in the future, but for now just wanted to let you all know it's there. So take a look, let me know what you think, and if you think it applies to your Strengthening Families efforts in particular, I'd love to hear about that. Other news from CSSP, we've just announced a new award, the Accelerating Change Award for organizations that are working with young women and girls of color involved in public systems. The applications are due March 11th, and the organizations that are selected to receive the award will also become part of a network, talking and working together about how to do this work and how to disrupt the pipeline that often leads from public system involvement to poor outcomes later in life. So really interested in finding out who is doing this great work in your states and your communities. If you could share the award information through your networks, we would really appreciate it. And again, that deadline is March 11th to apply, and you can do it right on that website. Download all the materials you need. Also, just out this week from CSSP, the President's budget was released, and we released a brief in response to it about supporting young children through the budget. So in this brief, you'll see a summary of key items in the President's budget that are related to getting to more equitable outcomes for young children and their families, and then strategies from 3 states that are using federal investments in innovative ways to advance equity in their early childhood systems. I really encourage you to check that out. As you know, equity is a major focus at CSSP, and we are excited about this brief that gives a direct connection between early childhood work and equity. Finally, we have a request from the Strengthening Families National Network, the Strengthening Families leadership team in Georgia, that have a member from the state PTA, the Parent Teacher Association, that's been participating in Strengthening Families meetings and is really interested in how to apply it more in the PTA organization's work itself. So I have not heard from others who are doing that, but I thought somebody out there might be. So I told Jeanette that we would check with the network. If you have PTA as part of your leadership team, or if PTA in your state or school district is implementing the protective factors framework in some way, please let Jeanette know. I'd love to be copied on that as well, but you can see her contact information here. If you don't grab her contact information, always feel free to contact me and I will put you in touch with Jeanette as well. Okay, those were all the updates from CSSP, and I will now hand it over to Teresa.
Thanks, Kaylin, and hi everyone. It's a pleasure to be with you today, and I have a few updates to share. We could go on, Kaylin, if you don't mind, to the next slide. First of all, wanted to let you know just a quick update about the Strengthening Families Training of Trainer events. We have one coming up very soon, as you'll see on the screen, March 1 through 3 in Fresno County. That one has already filled up, but we just wanted to let you know about it in case you have anyone coming or you'd like any more information about who is being trained there. We have one in Utah, and we've just gotten the registration link up, and it looks like Cassie from Utah is on the line. So we're very excited about this, and there will be a few openings there, May 17 through 19, and June 21st through 23rd in Wisconsin, and then July 12th through 14th in South Carolina we'll have coming up. And of course, if you want to know anything more in detail about any of these, please contact Martha Reeder at the Alliance, and we have her information there. Very exciting that we have close to 500, or after these trainings, we'll have about 500 certified trainers around the country, and they meet and are doing planning and work and looking at evaluation and other things. So we just encourage you to let us know if you want to know who's a trainer in your area or how we might blend the work that's taking place there to support any other work that you're doing in your state. So in the next slide, Kaylin, if you don't mind, one of the things we wanted to share today too is we don't normally come onto this meeting and talk about advocacy issues and awareness of potential or current legislation, but there is an act that is being discussed. It's not a formal act yet, and some of you may already be familiar with it, but it's really proposed legislation, a proposal that will potentially turn into legislation by Senator Orrin Hatch in Utah and Senator Rod Wyden in Oregon. And they are both, Senator Hatch leads the Senate Finance Committee, and Ron Wyden is the ranking member. And so the Senate Finance Committee has been having conversations about this act or this proposed legislation. We hope at the Alliance that it will turn into an act, and we hope it will get good discussion and good consideration. And we know that people may have multiple points of view about the importance of it and the way it should look in the end, but it's an opportunity that we haven't seen in a decade or more. It's really groundbreaking, and it's an opportunity to look at opening up what are currently child welfare dollars, Title 4E of the Social Security Act, that are entitlement dollars under child welfare, and opening them up to be used in more preventative ways also as an entitlement. And it's an exciting way to think about moving deeper into partnership with the community, moving earlier in the opportunity for families to have access to services and supports. It would support, as it is now under discussion, it would support substance abuse treatment for parents. It would support mental health services. And the third area is in-home skills-based parenting. And that really would relate to things like home visiting programs that we see as being very strong preventative programs. They require a form of evidence base. You know, none of this is written out in detail. It's all kind of narrative that may or may not make it into a bill. But if you would like to see this move forward to, at minimum, get more discussion, it would be really important as soon as possible to contact your senator, especially if you have a senator who's on the Finance Committee, because they are having those conversations internally right now. And if we've put a lot of information up on the Alliance website. If you'd like to go to the link we have at the bottom of the page, ctfalliance.org/action. And if you don't, if you're on the phone and don't see that, you can just go to our general web page, and there's a drop-down menu for public policy action, and you'll get it that way. But we encourage you to make sure you're up to date on it, and that you, if you have an opinion about it, weigh in on it pretty quickly, because if there doesn't seem to be interest in it, then it may never move forward to even become a formal proposal or have further discussions. So the time is right now. to tell people we're interested and we want to have the conversation. And we would be happy, of course, to do anything that we could to provide additional support and information if you're interested. You'll see some pretty detailed documentation on our website about what the discussions are right now. And so we welcome, many of you know Jim McKay, who works with the Alliance as a public policy consultant. You know me and you know Martha, and so contact any of us if you'd like to talk further. And then just a quick comment on the next page, on the next slide, is that we have been having more and more opportunities to help parents out around the country connect with their with the policymakers in D.C. So even in the discussions around this issue and around other issues, right now we're working on congressional discussions related to how to support parents that are involved in addiction and how to help support them in moving beyond that. And there's a high interest right now in hearing the voice of parents. Where we need your help is reaching out to parents in your own networks who may have life experiences challenges they faced and they've moved beyond them, and they have an interest in using their life experience to help educate and inform policymakers around issues that are currently, or in the future even, will be given attention. So the Birth Parent National Network has been more and more active. We have 100 parent members, about 40 organizations, and I really encourage you to think about parents you may know who may want to use their voice. We will support financially and in other ways all of their activities, but we just need to find out, you know, who is out there that would like to be involved and how can we help them make their voices heard. So I just want to put in kind of a fairly urgent plea to think about that and help connect any parents. Many of you on the phone have been involved in helping us to make those connections, and we really, really appreciate it. But we know it's going to grow, and we need a larger pool of parents with different life experiences to call on. So thank you all very much. Thank you for what you are doing and what we can still do together. And I'll hand this back to you, Kaylin.
Thank you so much, Teresa. So with all those updates done, we're going to get into the topic of the day, beginning with a conversation about the Caring Conversations Cafe. So I'm going to hand the stage over to Aidan Bolander from 0 to 3 and Jamie Ward from Curricula Concepts to talk about the model and how it's being used in Arkansas.
Wonderful. Thank you, Kaylin. Good afternoon, everybody. This is Aidan Bolander. I'm calling you from 0 to 3 here in Washington, D.C. And as Kaylin said, I'm happy to be joined by one of our fabulous piloters of this guide, Jamie Ward from Arkansas. So if you can just go to the next slide. Thanks, Kaylin. So we would be remiss if we didn't just mention who we are, but 0 to 3 is a national nonprofit here in D.C. for those of you who have not heard of us. We're proud members of the Strengthening Families community, and our focus and our mission is to ensure that all babies and toddlers have a strong start in life. So to that end, when we were approached, and I'll tell you a little bit about that, but when we were approached about the CAFE model, one of the things that we thought about was, where do our babies and toddlers spend a majority of their time, their waking time? And that is in childcare in the United States. And so our model is slightly different, and we can get into that, but we talk about partnering with both parents and providers. So this is a parent-provider cafe that we're going to be talking about. All right, next slide. Thanks. As I said, my name is Aidan, and I am a writer and trainer for 0 to 3, social worker, proud social worker by training, and I'm calling in from Washington, D.C., and I have Jamie on the phone with me. Jamie, do you want to introduce yourself?
Sure. I'm Jamie with Curricula Concepts in Arkansas, and we provide coaching and mentoring and professional development to early education providers here in the state.
Thanks. So how did the Caring Conversations Cafe model come to be? There are lots of cafe models out there, and we were definitely later to the game. We're not first to this game. 0 to 3 is not. I know Kaylin's going to go over some of the different types of cafes, and we have some really wonderful people, folks who came before us and have been using this model, which is based in the World Cafe model very originally, and they're going to be talking about that. So we'll focus on Caring Conversations right now. So the Caring Conversation Cafes are guided conversations about topics for parents and providers that help promote the optimal development of children. So all of our topics have to do with child development and the issues that parents and providers both contend with as they care for very young children. And they promote community conversations, bringing parents, providers, and other community leaders together. And we have embedded the protective factors. And of course, we're focused, our questions are more geared towards working with the youngest children. And it was important to us and to the folks who originally approached us to develop this model, the Minnesota Department of Human Services, to weave in an understanding of culture throughout the model. So an understanding that our values, beliefs, and assumptions come with us when we come into these conversations. Next slide. So as I said, parent and community cafes are originally derived from the World Cafe model. The World Cafe model has a really lovely website, so if you're interested in kind of where everything started, I suggest you go there. And of course, I can't remember it off the top of my head, but I can put it in the chat box when I stop talking. But cafes are a method of having really reflective conversations and bringing people to the table who might not necessarily come to the table otherwise to kind of promote leadership and collaboration. It's a very collaborative model, and I like to think of it as a very much of an empowerment model. We originally were approached, this was not our very original idea, this was the idea of the Minnesota Department of Human Services, specifically, I don't know if Joanne Mooney is on the phone, but Joanne Mooney from Minnesota really wanted to bring a cafe model to the state of Minnesota. And specifically, she was most interested in bringing together parents and early care and education providers and child welfare providers to the table together. So to have parents and providers having conversations together about how to best promote the protective factors and care for our youngest children in the best way possible. And in order to kind of facilitate that, she really believed in, and we got on board with her, that the cafe model was a really wonderful model to start with. And so we produced a model for Minnesota called the Minnesota Cafe Facilitators Guide, and under the leadership of Joanne Mooney and Kimberly Stone. Next slide. And then we were approached when we were done with this. We had a really wonderful conversation with Jamie Ward in Arkansas about, you know, she asked us kind of what kind of work we were doing, and we were talking about the cafe, the Parent Provider Cafe Guide that we put together for Minnesota. And she asked if that would be something that they could access. But the guide had originally been written for Minnesota with some very specific things to Minnesota. It had always promoted the protective factors. It had always talked about parent-provider engagement, and it had always included some of our parent-provider handouts that are part of the Sharing the Care Doris Duke project. But what it also did was kind of talk about some of the history of Minnesota and how Minnesota came to the work. And also it brought into effect some aspects of Minnesota law around talking about child abuse and neglect disclosure if that happens during the cafe, those kinds of things. And so there were some very specific Minnesota things. And so Jamie partnered with us, Curricula Concepts partnered with 0 to 3 to revise the model so that it could be available to kind of a more general public, and that's how the Caring Conversations Cafe model came to be. Next slide. So we won't go through these, but usually when we're introducing the cafe model, we spend a lot of time going through the protective factors, but we do just want to say that the protective factors are woven throughout every cafe. They're specifically paired up, the particular protective factors that are highlighted for each cafe, of which there are 7 within each cafe. So we're very explicit about which protective factors we're kind of highlighting in each cafe. Next slide. All right. So as I said before, the cafe comes out of, this graphic is from the World Cafe website. So there you go, it's worldcafe.com, theworldcafe.com. There on the bottom. And one of the really interesting things I think about any of the cafe models is that it really sets the tone for folks to come together and listen to one another, and to have, as we like to call them, meaningful conversations. But there's a real sense of mindfulness in the cafes, or the ones that I've participated in, and everyone's kind of encouraged in their own way to participate, whether that's through speaking or participating through written word, those kinds of things. And so I just thought this was a beautiful graphic that I would share with you all, and it's available on the World Cafe website if you're interested in looking at it. Next slide. Thanks. So some of the questions we get a lot about the cafe are, how does this work? And I have to give a shout out to Carolyn Abdullah, who is on the telephone with us. She is one of the co-authors of the Caring Conversations and the Minnesota Guide. Hi, Carolyn. And Carolyn pointed us to the World Cafe website to see some of the graphics when we were trying to explain how a cafe takes place. And generally how it takes place is that folks are seated in the beginning at a table. They can choose what table they want to be seated at. And they're sat in groups of 4 or 5. This is for our cafe. There are different ways of doing it for other cafes. But they're sat in groups of 4 or 5, and there's a piece of paper on the table. And there is a table tent with the question that they're going to discuss at that particular table. And then they're given a particular period of time to kind of discuss that table. And then there's one person who remains at each table, a host. I'll explain that in a second. But the other people kind of get up and rotate and move to a different table. They don't all move together as one group. As you can kind of see from the graphic here, they can move to different tables and so forth and so on, so that everyone kind of gets to talk to one another. And then they approach a different question. And so I really think this graphic is nice in that it kind of explains the process if you're thinking about what does a cafe look like. So next. I think there's one more picture. Yeah, so this is a picture of, you know, what it would look like at the table. And again, this is from the World Cafe website. And on the table is a piece of paper, and people can contribute through their written word, or their written word on the table on the piece of paper, or they can speak, you know, and talk about. And the host, the person who stays at the table, records kind of what's going on in the conversation. Go ahead, next slide. Thank you. All right. So now you have a little bit of a sense of the tone and kind of maybe the process a little bit. These are the topics that we have for our cafe, the Caring Conversations Cafe, and you'll learn from other folks who are going to be on the phone that that there are many topics you can have cafes on, but these are the ones that we do. And you can see that they're all around early childhood. So we talk about strong parent-provider partnerships, building children's self-esteem, healthy brains, the importance of culture. We talk about temperament. We talk about everyone's favorite topic, challenging behaviors. That can bring up some really interesting conversations. And also then, of course, another favorite, but taking care of myself, which means the provider or the parent, when a child pushes your buttons. So those are our topics that we talk about. And when we talk about the cafe, when we talk about any cafe, there really is, especially in the very beginning, usually a person who comes together, brings people together to kind of put the cafe together, to hold the cafe. And we call this person a facilitator, and that's kind of general language that's used in the cafe community. And the facilitator usually provides guidance and coordination so that the cafe process can actually happen. And they usually recruit some folks in the community who can be what we call hosts. And those are those folks who I said stay at the table and help do the recording on the piece of paper that's on the table, and they help kind of keep the conversations going at the table, because sometimes when you bring folks together who don't normally sit at the table to talk together, sometimes they need a little bit of encouragement to talk. And then also, if you've ever facilitated a group, sometimes you have folks who talk a lot, and you want to make sure that everyone at the table kind of gets their chance. And so the hosts are folks that we kind of, the facilitator kind of orients and supports at each of the tables. And then, of course, we have our participants. And the expectation or the role of the participant is that they actively participate in the conversations throughout the cafe. And this is a picture, sorry, this is a picture on the right here of a cafe happening. They don't all have to happen at round tables. If you don't have a round table, it doesn't mean you can't have a cafe. But the round tables are great if you have them. All right, next slide. We realized when we were putting together the cafe that in order for the cafe to be useful to a large kind of swaths of audience, we needed to incorporate the idea of culture into the cafe. And the definition that we use of culture for this model and throughout a lot of 0 to 3 products is the idea that everyone has values, beliefs, and assumptions that they bring with them to any interaction from their own life experience. And so to honor that and to speak respectfully to one another and to listen respectfully to one another. And so that's kind of an adaptation that we have woven throughout all of our guidance within the cafe guide. And then also we have kind of a separate piece that asks folks to consider language around family composition, that, you know, we have single families, we have same-sex families, we have grandmama raising, you know, the kids, and so to just be sensitive about the language you use when you're talking about parents. And then, of course, being respectful of whatever the home language is in the community that you're working in, and making sure that you're trying to accommodate that. If the majority of people who are attending the cafe speak one language, then it would be really nice if you could have hosts and facilitators who speak that language. Also taking into account literacy, so we tried to make the conversation questions at a 3rd grade reading level. Let's see here. Taking into account, of course, adolescent parents and how a cafe might run slightly differently if you're working with much younger parents. And then, of course, being very respectful of the folks that are our male caregivers or our fathers who are in the audience, and not always using pronouns that refer to she or mom or her as the caregivers. Okay, next slide. Ooh, I'm going to be out of breath here. I'm glad Jamie's going to be talking here in a while. We also wanted to honor the fact and have woven throughout the cafe that some of these conversations sometimes can bring up really sensitive issues and kind of hot button issues. And so it's important to be, of course, aware of what's going on in the local community or even nationally sometimes. And then we ask the facilitators to kind of help the hosts know how to signal when they need maybe a little bit more support at their table. And then also some things to consider when they're kind of, when sensitive issues get brought up, so that people feel very supported so that they can speak, so that they can participate. Next slide. All right. So the way that we have our cafe set up is very similar to a lot of the other cafe models. where there's a little welcome, there's an introduction. Our introductions have to do with saying something about yourself and then saying something about the topic of the cafe. So for culture, for example, we talk about life experiences and traditions. And so the introduction is, you know, hi, my name is Aiden, and my family and I make pancakes what's something you do, you know, regularly? What's a tradition? We make pancakes every Sunday morning. Then we move on to what we call paired conversations. And paired conversations, which you'll see an example of in a second, are getting people kind of warmed up to talking to one another, but they're just going to talk to a partner or somebody next to them at a table. Then we move on to those discussion questions, and that where folks talk at their table and then rotate when they're done. And there are 3 conversation questions or discussion questions for each cafe. So folks would rotate from their table 3 different times. Then we end with a group reflection because, as we all know, reflection is super important, especially when you bring up some really maybe sensitive issues that folks are talking about. And then we encourage folks to come up with their own closing exercise, practice, or ritual that means something meaningful to their community to close out the cafe. And then we offer additional resources and evaluations at the end of the cafe. So this is kind of the process. Next slide. All right. So when we talk about paired conversations, this is just an example of some of the instructions. So we ask folks to pair up. We go over what active listening is because we want them to be able to use it. Then, and of course later when they get to the conversation questions, the table questions, and then we make it time limited so that each person gets 2 minutes to talk, so that so that the paired conversations don't go on forever and everybody feels like they have their chance to talk. And each of the cafes has a unique conversation activity that goes with the topic of that cafe. On the next slide, we have an example. So our first cafe, Cafe A, is building strong parent-provider partnerships. And you can see what the instructions are here. And we introduced that we're going to be talking about partnerships with others. And so we ask each partner to share about somebody that they go to when they want to talk about something important. And how does that person make them feel? And what does the person specifically do to help them feel that, make them feel that way? So this is our partner conversations, and it's just an example of one of the things we do to help people get warmed up to talking with one another. And then we're winding down here, and I want Jamie to have her time, and we're running out of time. But this is an example of the table questions that would happen at each of the tables if you were doing Cafe A. And I'm going to move on because I want Jamie to have her time. This is just the agenda again, so you can see where everything flows. We'll go to the next one. So again, super excited to have Jamie here, Jamie Ward with us here today, and she's going to talk about how they've been using this guide in Arkansas. Jamie, take it away.
All right, thank you. I'll quickly just go through a couple of slides here to share our experience as we've implemented the Caring Conversations. So curricula concepts, we partner with the University of Arkansas Early Care and Education Projects we've partnered with them to bring the Caring Conversations here to Arkansas, and we're working with child care and others working with families. Also, each of our facilitators, I'll just mention, that are conducting the Caring Conversations have all been, they're all Alliance certified trainers, and we think that's real important. So we began to roll out the cafes just 1 year ago in the spring of 2015, and decided pretty quickly that we needed a plan, maybe a little different plan than what we anticipated, because the concept of the cafes is so different for those whom we're working with. We developed a plan to try to give folks a taste of the cafes first. So we did that by presenting at different conferences throughout the state. So we attended the Head Start Institute, the Home Visitor Conference, our Arkansas Early Childhood Association Conference, Special Ed Conference, several regional conferences, and so on. and walked through one of the cafes with the participants at each of those conferences. So as we did that, though, we would stop and add in information throughout the session, just letting them know what we would do if we were to come to their facility, such as the planning meeting, why each of the components are important, and so on. That strategy has been really effective for us. It's allowed us to get the word out about the cafes to a pretty broad audience across the state. We also decided pretty quickly that it would work well in our child care programs to do the cafes first with staff. And so we've done that in several facilities. Our intent really was to get the buy-in from the staff so that they would share, and encourage parents to attend. Of course, most of the staff are parents, so this worked well for them. And then even those who aren't or who weren't parents, they still have caregiver experience, so the cafes were relevant. So this worked really well, and I'll show you some of their feedback shortly. So next slide. So when the slide was put together, we were at about 187 participants to date. We've had a couple cafes in the last week, so that number now is up right at a little over 200, I guess. And we've been in a variety of program types, as you can see on the slide. Our initial thought was that we would really focus on private child care who receive federal subsidies for the majority of the children in their care. We wanted to focus on providers who were not state-funded pre-K, who were not Head Start, and really give them an opportunity to experience these cafes. So there has been some challenges there, but we're working through those. The next two groups are both home visiting programs. That has really been a natural fit with the caring conversations, and we're seeing a lot of success there. And then I did want to mention, I didn't put on the slide, but Aiden reminded me something she said. We have done a couple of teen parent groups, and those, quite honestly, have been some of our best cafes. Next slide. I want to point out just quickly a couple of things that we've learned as we've implemented. So the first thing is that the planning process is critical to success. When we've been able to fully engage each of the players, so the director of the program, each of the table hosts, the parent representative or the staff representative, when they've been fully engaged in that planning session, the cafe has been much better attended and it runs much more smoothly. Since this is such a new concept, they're used to us just coming in and delivering training or delivering professional development on certain topics. The planning process has been a bit of a hard sell, but once they understand the meaning behind it, it sure does make things go more smoothly. So those who attend the planning meeting have appreciated really getting to the side of the group on the cafe topic, all the details from snacks to music to all the logistical information, all those details that really make the environment conducive to a fun setting, but still in an intimate setting where these meaningful conversations can occur. The table host, this has been a learning experience for us. We spend quite a bit of time when table hosts are going to be doing their job for the first time, really making sure they understand their role prior to that experience, and that they're comfortable in that role. Sometimes we've had a couple who have we've shared what the role would entail, and they've said, that's not really for me. And so we've had to work with programs to find folks who felt comfortable doing that. Of course, the experienced host, once they understand the format and the flow of the cafe, most of them are willing to do it over and over again. Setting the tone, I wanted to mention quickly, we really do make a point to set the tone at the beginning of each cafe. We talk about it being a safe environment. We talk about the intentionality of each part of the cafe, so the introduction, the conversation, the paired conversation, the cafe conversation, and so on, that each of those has a very specific intent and purpose. And we find that once the participants realize that, they join in a little more easily. And then I added the reminder memos here because that's just a place in the cafe where we always sort of see their eyes light up because it's something that's so different than anything we've done before. So they, at the end of the cafe, they write a memo to themselves. we have started using really colorful envelopes that they put them in, they address it to themselves, and then 3 weeks after the cafe, we mail that memo to them, and it reminds them of maybe something that they've learned they didn't want to forget. They're given a prompt to write to on each memo, but sometimes they just add extra notes to themselves, so we like the reminder memos. Next slide. The next couple of slides, I've just listed some feedback here. Program directors have found it to be, very unique, positive, just a valuable experience for their families and staff. You can see some of the quotes here. The next slide is feedback from participants, and our participant response has just been overwhelmingly positive. They've told us things like they now have connections with other parents that they never had before, connections with staff that they never had before. They feel supported. They feel a sense of belonging. Just over and over, we've heard these positive statements. And then the last slide. These are just some more comments here from cafe participants and teachers and staff, just how a successful cafe really starts to develop that sense of community between parents and parents, parents and staff, staff and staff. We've really seen the protective factors come to life in these caring conversation cafes. I've shared a lot with staff in the planning meeting that we often think we know what families need in terms of resources and support. We know what we think they need, when in fact we really don't. And these meaningful conversations have really opened the eyes of program directors and staff to the real needs of families and their programs. So that's some of our experience here in Arkansas, and I'd be happy to answer any questions if there are any.
Thank you both so much. I know we are a little bit over time for everyone else to get their time in. I'm just going to ask the one question that I saw come in about how long the cafe is scheduled to take with that agenda.
So we estimate that it takes about an hour and a half. Jamie, what has been your experience?
Yes, right at an hour and a half. We plan for, 2 hours, a little over 2 hours to set up and clean up, but we keep it right at an hour and a half.
Okay, thank you. I think we're going to go ahead into the rest of the presentation so that we have time to get to everyone, and then hopefully round up for some questions at the end, which may also be relevant to your presentation. Thank you both so much. So I want to give a little bit of context about how caring conversations fit in with the bigger world of cafes in the Strengthening Families movement, and Aidan referred to this as well. The Parent Cafe was initially developed based on the World Cafe model, but developed by parents who were convened by Strengthening Families Illinois way back in the pilot phase of Strengthening Families implementation. So over 10 years ago now. And then the Community Cafe was developed not too long after that by volunteers as part of Strengthening Families Washington State. And they formed the Community Cafe Collaborative that continues to offer support for people who want to implement that, just as in Illinois, Be Strong Families is now a nonprofit organization that supports implementation of parent cafes as well as other work related to protective factors and helping parents and children thrive. Then the Caring Conversations came from 0 to 3, as Aidan and Jamie just described. And many states and communities have implemented cafes using one of these models or their own adaptation. And so about 2 years ago, we at CSSP pulled together people who were implementing, the developers and some implementers of each of the models to talk about common ground between them, and sort of, we called it a cafe fidelity working group, because we really wanted to talk about, people hear the cafe idea and get very excited about it and want to go home and do it. But in some cases, using that idea and that structure for a conversation can just be a good conversation. In other cases, when it's done with a lot of intentionality, it really can build protective factors in parent leadership. And we wanted to get at what needed to be in place for it to be effective in that way. So I'm going to ask representatives from the Community Cafe Collaborative and Be Strong Families to talk a little bit about their work. And then if we have a minute left, I'm going to share what we came up with in that working group. But I will point out that in the handouts list for this for the webinar, you can also see the overview about cafes and the cafe fidelity checklist that I'll be referring to later. So our next speaker is Robin Higa from the Community Cafe Collaborative, and she's going to talk about what's going on with them in Washington.
Great. Thank you for having me, Kaylin, and everyone. And it's good to hear how equitable conversations are helping parents and families and providers all over the country strengthen families. A couple of new things have emerged out of our partnership with the Alliance, and I just wanted to share this to sort of broaden people's thinking. The community cafes take more, also a bit of a community building lens, and so we've been pretty intentional about having conversations with people who are hosting cafes in their community about what are the issues that are happening in their community, and who are the system partners that could help them develop significant changes. A good example coming out of New York and Oregon is, and emerging now with in Colorado, is partnerships between folks who are working on strengthening families, and also partners like Project Launch. As conversations emerge in different communities, we're seeing a lot of families talk about healthcare, mental health care, and also the percentage of children who are entering kindergarten who would have qualified for early intervention but have not received those, have not received any services, and the state of Connecticut is also partnering with the early childhood system, who does comprehensive screening for all kids, and they're using their cafes to share the data by community with families, and then having the host conversations around with that strengthening family thread and the additional knowledge of this data. Project, there is now a new community cafe leadership team that emerged out of the cafes that New York has been hosting. I think they've got well over 30 sites in New York now. So anyone interested in learning how to host these who live on the East Coast, you have friends who are available to help you there in New York. And in Nebraska, a leadership team is developing there, and also another leadership team in our very own Bellevue, Washington. So lots of people out there who want to support you. If you'd like to start something like this, then feel free to contact Teresa at the Alliance, or contact me directly. There's the email on the bottom. Bottom line is, don't forget your unlikely partners, and a shout out to Project Launch.
Thanks, Robin. That's great to hear those updates. And Robin's email is on the last slide that I'll show as we're wrapping up here. So if you want to contact her directly, you can. Thank you so much, Robin. And now we're going to hear from Dara Griffin with Be Strong Families.
Thanks, Kaylin. Thanks, everybody, for being on the call. I just feel really compelled to give a shout out to Lisa Lee, Lena Kramer, and the parents of the Illinois Family Partnership Network, who had the vision and foresight to really adapt the World Cafe model into a process that's obviously working for all of us to engage families, build professional and personal capacity, and build the protective factors in communities. With Be Strong Families, we have released our Dad's Parent Cafe in a Box, which speaks specifically to male and father issues, and we've been doing dads only cafes in Illinois for a number of years, and we are moving out into the rest of the country to promote Dad's Parent Cafe in a Box and the value of having dads come together to speak about building the protective factors in their own family, in their own families. We also had a group of dad that adapted the protective factors language into dad-friendly language, which is really interesting because it's a little bit different and speaks more to the father issues. We do have a couple of Be Strong Families Parent Cafe Team Training Institutes planned throughout the country that start in April. So in April 27th and 28th, we'll be holding an institute in Pasadena. May 12th and 13th, we will be in Richmond, Virginia. In May, the dates are to be determined. We will be in Madison, Wisconsin. And in June, the 8th and the 9th, we will be holding an institute in Chicago. We're also continuing to support the people that we trained in any organization or community that's interested in a cafe approach or implementing a cafe approach with a Cafe Success Exchange webinar that we also host every fourth Friday of the month from 1:30 to 2:30 p.m. Central Time. And this month will be on February 26th, I believe, and the theme is diversity, building bridges, creating community, and diffusing conflict. And so we are, having conversations with those individuals and systems and agencies and organizations who are implementing a cafe approach for them to kind of come together and talk about what they're seeing, what they're learning, and exchange that information and wisdom with each other. I'll just end by saying that the purpose of Be Strong Families Parent Cafes is individual deep self-reflection and peer-to-peer learning in an effort to build the protective factors. And so I just, again, want to thank Kaylin, CSSP, and the other partners. And if you have any other questions or want information, please visit www.bestrongfamilies.net.
Thanks so much, Dara. Okay, we are almost done here, and I see a couple questions were typed in. I'm going to say my 2 minutes about this cafe overview, just so that I'm sure everybody knows about it, because I think as you consider all these great, the great things you've heard about how people are using cafes, I want you to just be thoughtful about how you would do it in your own community, and certainly seeking out training and guidance from any of the partners who have spoken today is a great way to go. But whatever you end up doing, I hope that you can be sure your cafe is going to adhere to these core elements. So the handout is in the webinar panel, or you can get it from our website. But we go through these core elements that need to be in place. And this is based on the experience on the ground from people using all different types of cafes. So for each core element, there are a few fidelity indicators that are to really say what we mean by that, and these were agreed upon by all the partners. It took some hammering out to figure out exactly what was core and what was specific to different models, but we're pretty happy with what we landed at. I'm not going to talk through them today because of the time constraints, but I hope that everyone will check that out and seek other information as you need it. I did want to just quickly mention the couple questions that are here. Someone asked about what kinds of languages the Caring Conversations model is available in. And I can, while Aiden perhaps gets ready to answer that, I can say that I think for all of these cafes, the materials that are available may be in English and possibly translated to other languages, but you could really conduct the cafes in any language that was the language of the community you were working with. But Aiden, did you want to answer that question about Caring Conversations?
Sure. It's currently just in English, but we would welcome anyone who wanted to partner with us so we could translate it into other languages.
Wonderful. And also related to that, we had a question about where we can find the curriculum from the cafe activity. So I'm not sure if you gave a link directly to Caring Conversations. Would you want to paste that into the chat box?
I didn't. I can put it into the chat box. It's just available in our bookstore, and I think it's either $19.99 or $25. We tried to keep it affordable, but it's available in our bookstore. But I'll link to it now.
Okay, great. We also had a note from Carla Keener in Oakland who said, we allow for 2 to 2.5 hours for each cafe with an additional 30 minutes on either side for setup and cleanup or debrief. which is helpful information to know how it's working out in Alameda County. And then there was another question about childcare being offered during the cafes. I think that's a recommended best practice. Not sure if anyone wants to chime in about whether you do that.
This is
Aiden. Oh, you go ahead, Steve. Go ahead.
I was just going to say we offer childcare at each cafe if that's something that the planning team wants to offer, and I can tell you it has been 100% of the time.
Okay. Yes, I think that's one of the key things. Childcare, and if you can do it, also food. That's what helps parents be able to get there, especially in an evening. And Roxy Foster from Minnesota also mentioned that Robin has a wonderful model for kids cafe, so you can do a parallel process for the kids while their parents are in the cafe for grown-ups. And Carla types, good, nutritious food for both parents and families. So I think this is evidence of how much experience there is around the country with these great models, and I'm so happy that everyone was able to join us today. I don't want to keep anyone over, so we are going to wrap up now. Just thank you so much to our presenters and to the participants who joined in and who asked questions and shared their information. As always, we have recorded the webinar. You will get a follow-up email with a link to that recording. It'll also be there will be a link to it in the Strengthening Families e-update that comes out later this month. So thanks, everyone. Have a great rest of the day, and keep on strengthening families. Thank you all.